Good morning. So now we are going to do ABG interpretation. Okay? So what you need to understand, we're going to walk through five problems. Not only do you need to know, is it respiratory acidosis versus respiratory alkalosis, metabolic acidosis versus metabolic alkalosis, you need to understand, are they fully compensated, partially compensated, uncompensated? So what that means, if you say that an acid-base problem is fully compensated, that means the pH has gotten all the way back to normal. That means with our systems, buffers, the lungs, and the kidneys, we have gotten our acid-base balance back into homeostasis, back to the normal value. Partially compensated means our pH is still off, but now particles are starting to shift in certain directions to compensate. For instance, if we're in acidic state, maybe our CO2 is decreasing and becoming more basic to try to cope for that acidic state. So that's what it means when it says partially. And uncompensated means we have an acid-base disorder, but our body has done nothing to try to fix this problem. And you'll understand what I'm talking about as we continue to move forward. I want you to draw your tic-tac-toe board, just like I've done. Make sure you put acid, normal, alkalosis, and I want you to draw your pH, 7.35 to 7.45. And we know that anything less than 7.35 will be on the acidic side. Anything greater than 7.45 will be on the alkalotic side. We always, when we're looking at ABG interpretation, we need our pH, we need our bicarb, and we need a CO2 level to figure out what type of acid-base balance it is. However, you see when we draw ABGs, I did not include the PaO2. Your PaO2, or your arterial oxygen level, is the most accurate indicator of oxygen in our body. So the first thing when you look at an ABG should always be to look at that PaO2 level. Because if it's less than 80, we should always know our normal values. PaO2 is different from pulse ox. It's 80 to 100. You better be thinking, I need to intervene because oxygenation is priority over acid-base imbalances. So when you look at ABGs, first thing, look at that PaO2 level, ensure that it is appropriate. If it's low, well, then we need to act on our patient. Now getting back to acid-base interpretation, you've set it up like this. We have to know our other levels. We only need CO2 and bicarb and the pH to interpret the ABG. When I write the CO2, pay very attention to how I write it. Because we're going to get into the habit, everything to the left is going to be in the acidic column. Everything to the right is going to be in the alkalotic column. So because CO2 is an acid, we know our normal levels are 35 to 45. I want you to flip it around. I want you to put 45 to 35. And that way we get into the habit again. If it's on this side, we understand it's acidic. So if you have a PCO2 that is greater than 45, say we have a PCO2 of 46, it's going to be on the acidic side because CO2 is an acid. So the more acid we have, the more acidic it is. And then if we have, for instance, a PCO2 that's 30, well, this is an acid, and now we have a low level of acid, it's becoming more on the alkalotic side. And then your normal bicarb is 22 to 26, and you need to write it just like that because we know bicarb is a base. If we have low base, say we have a bicarb of 18, it's going to fall on the acidic side. And you'll need to know that when we start filling in our tic-tac-toe. So I want you to make sure to make your tic-tac-toe. I want you to set up your pH, your CO2, and your bicarb just like this. Make sure your PCO2 is flipped around, okay? 45 to 35, not 35 to 45. And we are going to solve these ABGs, but also determine, is it fully compensated, partially compensated, or uncompensated? Something else you need to write right here is we need to understand that if it is a problem with our CO2, we know our lungs control our CO2, so it will always be a respiratory disorder. So you can just put an R next to your CO2. If it's a problem with your bicarb, you know your kidneys control your bicarb and your hydrogen ion. So you're going to put an M for metabolic if we see that it's a bicarb problem. So it's going to take a little practice, but we are going to plug these ABG's levels into our chart. And it's very simple. you start with your pH. And we're going to start with number 1, 7.55. So we know it's not in the middle, so it's not normal. And we look, 7.55 is to this side, so we know our pH, we know we're in an alkalotic state. So on your chart, you need to put your pH under the alkalosis side. Let's look at our next level, CO2, okay? Always see if it's normal. It's not. Our normal level for CO2 is 45 to 35. Well, let's see what side. So is your CO2 of 20 greater than 45 or less than 35? And it's less than 35, and so we have less CO2 than our normal level. So our CO2 falls to the right side of this, and it's going to be alkalotic. So again, you look under this chart and you put your CO2, okay? And then let's look at our bicarb. Our bicarb is 19. It doesn't fall in the normal spot, so we know we can't put it in the normal column. Your bicarb is to the left. It is less than 22. It's not greater than 26. So we know we have low base. So that means our bicarb is now on the acidic side. So I want you to put it in the acidic column. The next thing I want you to do, I always want you to see what, if CO2 or bicarb is under the pH. So if something's under your pH, I want you to circle it. And we know that the lungs control CO2, and it's on the same side as our pH. So we are going to understand that the lungs control this. So it's going to be respiratory alkalosis, okay? Respiratory alkalosis. So we're not done. We determined that the lung is the organ that controls CO2, and CO2 is alkalotic along with our pH, so it's respiratory alkalosis. However, is it fully compensated, partially compensated, or uncompensated? Remember, the only time ABG can be fully compensated, the pH would actually have to be normal. So we know it's not fully compensated. So let's talk about uncompensated versus partially compensated. We said if the body is trying to fix the problem, say your buffer system kicked in and hydrogen ion or whatever is moving in and out the cell, if the body has tried to help that problem in some way, we are going to think partially compensated. So let's look at our bicarb. Our bicarb, our normal bicarb level is 22 to 26. So this is not normal for our bicarb. Our systems have started to cope, and we have changed our normal base level to a more acidic level because we are in an alkalotic state. So we have in our bicarb as in a more acidic state is helping this alkalotic state. So this is tried to help the problem. This is respiratory alkalosis, partially compensated. And just stay with me. It's going to take a couple more tries. A little bit more practice. So let's rewrite our chart. Let's look at number 2. First thing we look at is the pH. Okay? pH is 7.54, so it's greater than 7.45. So we know it's going towards the alkalotic side. So put it under alkalosis. Next, let's look at our CO2. Well, our CO2 does not fall in the normal range. It's 24, okay? So 24 is less than 35. So again, our CO2 is on the alkalotic side. So you're going to put your CO2 here. Let's look at our bicarb. Our bicarb is in the normal range, okay? So our bicarb, we have to put under the normal column. So again, you always circle what is under your pH to understand what disorder it is. We know our lungs control CO2. So this is respiratory alkalosis. And we know it cannot be fully compensated because the only time your ABG is fully compensated is when your pH is back in the normal range. Your pH is not back in the normal range. So now let's think. Is this partially compensated or uncompensated? So to determine that, you always look at the other component, whether this is CO2 or bicarb. So our bicarb is in our normal column. That means the body has done nothing to try to fix this problem. Our bicarb is the same level. It's always been in our body. So our body has not compensated at all. This is called respiratory alkalosis uncompensated. The bicarb has not decreased to become more acidic to try to help this alkalotic problem. So this would be uncompensated respiratory alkalosis. Okay? Let's keep practicing. Let's move on to the next one. Your pH, 7.17. So let's look at our normal range. So 7.17 is less than 7.35. So our pH is on the acidic side. So you're going to put it on the acidic side. Let's look at our CO2. It's 35. And that is in the normal range. Our normal CO2 is 45 to 35. So we will have to put our CO2 in the normal column. And let's look at our bicarb. Our bicarb is 12. So we need to think 12 is less than 22. So we have low base. So we are now falling into the acidic side. So you need to put your bicarb on the acidic side. You always circle what's under the pH to determine the disorder. And we know the kidneys control bicarb. So you're going to put M for metabolic acidosis. So we have metabolic acidosis, and again, it can only be fully compensated if our pH had gotten back to the normal range. Our pH is not in the normal range, our pH is acidic, so it cannot be fully compensated. But we need to figure out, you look at the other ion, CO2. Our CO2 is the normal value, it always is for our blood. So has our body tried to fix this acidic problem at all? No. It has not tried to shift anything yet, for instance our buffer systems, to try to fix this acidic problem. It's done nothing to help this problem, so we're going to think this is uncompensated metabolic acidosis. Okay? Let's move on to number 4. So 7.45. Well, look, that is in your normal range. What I want you to do when it's in the normal range, I want you to put a little tick mark and write 7.4, okay? But our pH is in the normal range, so we have to put our pH in the normal box. And remember, you should either be thinking, hey, my body's fixed the problem because my pH is back to normal, so it's fully compensated, or you need to look at all your values and it could just be a normal ABG result, okay? So let's look at all of our other values. CO2. So we have 45 to 38. We know 48 is greater than 45, so we have increased CO2, so it's fallen on the acidic side. So put your CO2 in the acidic side. Let's look at our bicarb. Our bicarb is 28. So 22 to 26, we know 28 is greater than 26, so our bicarb is falling on the alkalotic side. So you put your bicarb here. So now we have to figure out, hey, I understand it's fully compensated because things have moved all around to fix this acid-base balance. But we still have to figure out what acid-base balance it is. So this is fully compensated because our pH is normal. What I want you to do, why we wrote that little 7.4, we need to look at our pH level. It's 7.45. So is 7.45 more on the alkalotic side, because 7.4 is the middle, or more on the acidic side? And if you think about it, 7.45 is more on the alkalotic side, okay? It's closer to a more basic environment. So we are going to draw an arrow to the alkalotic side because 7.45, again, 7.4 will be your middle, is more to the alkalotic side than the acidic side. And now we're going to write our pH, and we can figure out our disorder. You always circle what's under the pH, and we understand our kidneys control bicarb. So this is metabolic alkalosis, fully compensated. And we're going to practice one more problem. Last problem. Always start with your pH, 7.36. We understand, again, 7.36 is within the normal range, okay? So let's put our pH in the normal column. Let's look at our CO2. Our CO2 is 30, and our range is 45 to 35. Well, 30 is less than 35, so it's more towards the alkalotic side. So put your CO2 on the alkalotic side. Last thing, look at your bicarb, it's 19. 19 is less than 22, so we have less base, so it's making it more acidic. So we're gonna put our bicarb on the acidic side, okay? And again, our pH is normal, okay? So we have to think our body's coped. We are now fully compensated, but we still have to figure out what disorder it is. So again, 7.4 is your middle. We look at our pH. Is 7.36 more to the acidic side, or is it more to the alkalotic side? And your pH is more to the acidic side, so you move it over to the acidic side. You circle what's under your pH. We know the kidneys control bicarb, so this will be metabolic acidosis, fully compensated. I hope this helps. ABGs are just a lot of practice. So use this system and continue to practice your ABGs.